Changing a peripheral venous access site dressing. So that would be the transparent little dressing over top of your catheter, your IV. First of all, you want to make sure you have all your supplies. You're going to use one of those little pads again and put it under their arm. You are going to carefully, with your non-dominant hand, hold the catheter so it doesn't come out of the arm. And then carefully pull that old dressing off with your gloved hand. It could be stuck to the catheter, so make sure that you're doing that very easily so you don't pull it out and have to re-stick. You can use a adhesive remover. Take that off, discard your old dressing. You'll have your new one ready to go. You need to use a skin protectant before you put that back on, or clean it with the chlorhexidine first and then put your skin protectant on. Put your new transparent dressing on, and you need to label it: time, date, initials, time of the change that you did just now. Make your loop, anchor it to the skin with tape that's not going to bother their skin. And then unclamp your tubing and make sure your drip rate's right. Dispose of all of your garbage. Take off your gloves, perform hand hygiene, ask the patient if they need anything, make them comfortable. Capping for intermittent use and flushing a peripheral venous access device. First of all, you're going to make sure you have all your supplies you need. Put on your PPE, your gloves. You are going to, if you're using a pump, if you're using a pump or gravity, close your roller clamp, and close your clamp on the extension device, also the extension tubing that's closest to the IV catheter that's connected to the patient. Then you're going to disconnect the administration tubing from the extension tubing, and you are going to take an alcohol pad and scrub the needleless cap thing on the end of the extension tubing. Get your saline syringe, flush, and connect it to the extension tubing. Aspirate, make sure you still get that blood return to make sure that it's still working good. And then, according to your facility's policy, flush that line, disconnect your syringe, and you're going to put one of the little alcohol caps back on there. If it's not already done, make your loop, anchor it to the patient's skin with the tape that's not going to bother their skin, and that's it. Throw your trash away, wash your hands, throw your gloves away. Administering a blood transfusion. Make sure you have all your materials set up and ready to go. Ask your patient if they've had any previous blood transfusions, and if they had any reactions, ask them what their experience was like. Tell your patient that they need to report any fever, chills, itching, any rash, anything unusual, like unusual symptoms. You need to prime the blood administration set with normal saline. Put your gloves on. You need to connect your administration set with the extension tubing. Get your blood, however your hospital's policy has you do that. Get your blood. 2 nurses have to verify the blood. They have to make sure it's the correct patient, the patient's name's on there, birthday, the blood type and group, and they have to make sure some number, an identification number. They need to make sure there's no clots or anything in the blood, like in the bag, any clumps or anything like that. They have to get the patient's baseline vitals before this is done. If they have any fluids running, clamp those off. Close your roller clamp. Hang up your blood bag. Remove the tubing or the cap from the blood bag. Take your spike, remove your spike cap. Spike your blood bag. Hang your bag. I already said hang your bag, but if you don't hang your bag first, whatever, you can do that interchangeably. Start the blood infusion slowly. Monitor for reactions. You need to stay with your patient for the first 5 to 15 minutes. Make sure they're not having any reaction to the transfusion. Check the IV site. It's kind of like if you were given any other solution. It's just blood. Make sure there's no infiltration. Make sure there's no vein irritation, anything like that. And when your blood is finished infusing, then you need to close your clamp and remove your tubing and discard of all that. Perform hand hygiene, and the blood should infuse no more than 4 hours. After your first 5 to 15 minutes, you can set your rate to where it needs to be, whether it's counting your drips or on your pump. Changing the dressing and flushing the central venous access device. So first of all, this is partially a sterile procedure. You need to move the bed up to a comfortable working position. Have a wastebasket ready to throw away your old dressing. Start with clean gloves and remove that old dressing off of the CVAD. You're going to assess that dressing site through the old dressing. Check for tenderness or any redness or anything like that. Ask the patient if it's tender to touch that right there. Then you're going to throw that old dressing away with your gloves, and you are going to put on sterile gloves. So with your sterile gloves, let me back up. You need to be wearing a mask, and your patient needs to be wearing a mask. Your patient can either wear a mask or you can have them turn their head to the side. Either way. It depends on the hospital policy. Anywho, back to the story. Sterile gloves, you're going to wipe off any blood or anything that came or that's on that site with an antimicrobial wipe, a sterile antimicrobial wipe. And then you're going to take a chlorhexidine sponge and cleanse that site. And then you're going to apply the new transparent dressing over that catheter. And then changing the end caps on all the lumens. There could be 2 or 3 or whatever. Clamp your line. Take off the old one. Scrub the lumen. Put a new end cap on. Scrub the end of that, and then you're going to take your flush, connect it to it, and then you're going to aspirate, make sure you get a little bit of blood, and then you're going to flush that line, and you're going to repeat that process with all of the lumens. And then after you do that, you're going to put the little disinfectant cap on each of the lumens, and then you're done. And you can clean up your mess and lower the patient's bed, and you can remove your mask, and you can check on your patient in a little while. Accessing an implanted port. This is also partially a sterile procedure. You are going to want to start with clean gloves and wear a mask, and after your clean gloves, you're going to be putting on sterile gloves for part of the procedure. So make sure that you have all your supplies. Make sure that your bed is up at a comfortable working position. And first of all, you're going to put on your clean gloves and feel for that implantation device, the implanted port, and assess the site. Make sure there's no tenderness, pain, anything like that. So after you do that, you're going to remove your gloves and put on or set up your sterile field and empty any of the contents that you need, your items that you need, onto your sterile field. Then you're going to put on your sterile gloves. After you have your sterile gloves on, you need to cleanse the site with, or no, you're not going to do that yet. Put the needleless, the end cap, I'm at a loss for words, onto your non-coring needle, the extension set or tubing onto the non-coring needle, and then you're going to clean your site with your chlorhexidine swab for 30 seconds, not touching it after you clean it. Don't wipe it, don't blot it, let it dry for 30 seconds. And after you have that cleaned, then you're going to, with your non-dominant hand, with your sterile glove, you're going to stabilize the port and hold the skin taut. And at a 90-degree angle, you're going to push that needle. You have to visualize the center of the port, and at a 90-degree angle, you're going to push that needle down into the port. And then you're going to scrub the end of the, can't think of the name, the little piece there on the end of it, and attach your normal saline. And you're going to insert a small amount, make sure there's no infiltration and no fluid leaking around the needle onto the skin. And then you're going to pull back. If you get blood return, then you're going to slowly finish giving all of it. You can do the method that's like, I don't know what it's called, but you do that slowly with breaks in between. And after you do that, you're going to untwist your normal saline flush, and then you're going to put on the disinfecting cap on the end of the, I don't know what that's called, connector device. Put that on there. Too many devices. After you do that, then you're going to, there's like a secure device, or a device that secures it to make sure it doesn't like come out of the skin. And then after you put that on there, you're going to put the transparent dressing over that and make sure that doesn't come off. And then you clean up your mess and throw your gloves away and make sure the patient's comfortable, and you're done.